As my friend Neil O'Connell put it really well, if your bits hurt, you're not likely to want to have sex. So we consider that area, anything between the belly button and about mid-thigh, as your pelvic region. Certainly the genitals, so testicles and penis, and the rectal area and vagina and clitoris for women. Those, even just using those words in some settings and in healthcare settings will make people be like, well, we can't talk about that. And they'll make up all sorts of different names or get the areas wrong. Women in particular, the word vagina is used for the whole genital area, and that's not accurate. So it can make it really hard when you have pain in an area that culturally you don't really talk about. You might have been religiously brought up to think that talking about it or touching it hurts. Touching it is bad for you. Like the quickest way to damnation is to masturbate in some religions. If that area hurts, you lose those things where we would normally touch a part that hurts to comfort it that it's wrong or it's not wrong, or to show other people and share and compare. It's like, my hand hurts. Can I touch your hand and see if it hurts when I do this? We lose those opportunities when it involves a genital region. And I suspect that that's part of why pain can persist in the pelvic region longer than it might somewhere else, because those very things that we would do to get a part to feel better are the opposite is done. I'll tell my patients a lot, if you have pain in your labia, often people, or around the tailbone, people will say, well, don't sit and don't wear clothes that put pressure on the area. But if you have pain in your foot and it's a cramp, you step on it and you load it and you walk around and you use it. You wouldn't sit down and put your foot on the back of a sofa and just wait for the pain to go away. So it might be that what we're doing is offloading an area that we should be loading. And I think that might be another reason why it persists. But it's just tissues and muscles and things like everywhere else. It's the social load we put on the area that adds complexity. There can be a delayed onset of muscle soreness if you are suddenly acting with more frequency or duration than you normally did before. You could just be sore. You could also have just pieces don't always fit together comfortably, and you might need to adjust, so it could actually be technique. It could be a problem with lubrication or different times of the month. Your tissues are a little more tender or other things. So you don't have to rush to this as a pathological problem. It could very much be a functional, easy to change, put your leg there and it will feel okay kind of thing. Exercise, for one. The recommendation is still at least a half an hour of aerobic activity a day. Getting your heart rate up helps all of the small blood vessels do better. Do things that you love that are sensually rewarding. So it can be smelling something that you just really like and getting into that. I can be aroused by something and it doesn't have to hurt. It doesn't even have to be sexual. It can just be really nice. And practicing those things frequently. It still runs the arousal part of all of the patterns that we have and how we respond. And then it's really fun to talk about that, imagining it going well. So kind of like classic graded exposure, but to sex. It's tricky, the words are different. But truly to see it as a positive or see it as something that's gonna feel good, whether that's with a partner or with yourself. So activity, seeking pleasure, staying flexible and comfortable in your own body has a lot to do with how easily you will get aroused and how positive that experience will be.